Liposuction is probably the most commonly performed cosmetic surgery procedure in the country. If you looked at all of the statistics, typically liposuction and breast augmentation are neck and neck for number one and number two. 1 year it's liposuction, 1 year it's breast augmentation. The actual liposuction procedure involves removing fat from your body. Once it's removed, it does not come back. I periodically have patients ask me if it'll come back somewhere else, and that's really not true. If you go out and eat gallons of ice cream, you're still going to gain weight, but your proportions will always be better. So really the best candidate for liposuction is someone that has a specific area that's really just out of kilter with the rest of their body. The liposuction procedure is done primarily under local anesthesia. Most patients will also have a sedative to make them comfortable. They may get sedation through an IV so that they're not aware of anything. The operation typically is no more than an hour to an hour and a half. The patient is in the recovery room for a short time and then can go home. Patients are typically seen back a day or two later and then again at 1 week. People can walk around the day of the procedure. They can go for a short walk. They can have light activity. I don't want them to have strenuous activity for at least a week or 10 days. People are typically back in their office job within a few days. Even less in some cases. It depends on the amount of liposuction performed. It might depend on the body part that it was done. Liposuction under the chin alone is maybe a 15-minute operation. Liposuction in other areas may take longer. Now there's a lot of confusion about liposuction because people hear all these buzzwords. There are a lot of words that have been developed primarily for marketing purposes. But at the end of the day, all of these procedures require removing fat from the body. So whether you use a laser, whether you use an ultrasonic machine, whether you freeze the fat, whether you heat the fat up, at the end of the day you're destroying fat cells, you're getting them out of the body so that they won't come back. There are a variety of techniques that are available for liposuction, and after you have an face-to-face consultation, I would be able to advise you as to which technique is best for your particular situation. We have the whole spectrum of techniques available to us, but it does require me actually examining the patient to determine what will be best for you and give you the best result.